Give me a second. Can you tell me your name and date of birth real quick? Okay. So, I see that you have a cranial nerve exam scheduled for today. Okay. What brings you in for that? Okay. And when did that start? Alright. Yeah, I can take a look at it. Are there any other issues that caused you to come in today? Anything that might stick out? Okay, cool. Now usually we start with a smell test, but the symptoms you mentioned in your previous request for cranial nerve exam don't typically require a smell test to be done, okay? So we're going to skip right to your vision, alright? So you just had an eye test done recently, so we're not going to have to use the Snellen chart, which is the one with the letters on it. So I'm just going to do a visual test first, alright? So I'm going to hold my fingers up on either side of you, and I want you to keep your eyesight right on the tip of my nose. Can you do that? Okay, cool. And then without moving your eye, I want you to tell with your peripheral vision how many fingers I'm holding up. Okay, cool. So let's start. Just keep your eyes there. How many fingers? Okay. How many fingers now? What about now? No? Okay. And then one more time. Good, okay. I'm going to do the other side. Same thing. Keep your eyes there. Okay. Good, okay. So that seems to be fine. Next, I'm going to ask you to do the same thing. Just keep your eyes right there. And then I'm going to bring my finger into your peripheral vision, and you're going to tell me when you see it while keeping your eyes there. Okay. Okay, awesome. Ready? Okay. There, okay. Let's start that again. There we go. Okay. 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 Cool. Good job. Nice. Okay. Now I'm going to check your eyes with this light. Okay. I'm just going to turn the flashlight on. And I want you to look at my ear right here, okay? Okay. It's going to be a little bright. Okay. 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 Now I'm going to do the other eye. I want you to look right there. Good. Very nice. Nice. Okay. Now I'm going to have you do the same test, but with one eye closed. Okay. Alright, so I'm going to close your one eye. Tell me how many fingers you see, alright? Good job. Nice. Okay, let's do the other one. Just going to cover this one. Okay. Very good. Okay. Nice. Alright, well, your vision looks alright for now. Next, we're going to move on to your facial sensations. So, I'm going to do the same thing I kind of did, but with this guy. So, I'm going to tap this up against your face, and I want you to tell me when you feel it, okay? So, I want you to close your eyes for me, and I'm just going to tap this. Okay. Good. All right. Nice. Okay, so it seems like you can feel there. Are you able to raise your eyebrows for me like this? Okay, can you scrunch them? Okay, cool. Can you smile? Okay, frown. Yeah, you're gonna look a little silly while you do it, that's okay. Can you clench your jaw for me? Okay, and then I'm just gonna palpate right here. Clench your jaw again. And then I'm just gonna feel your face here. Okay. So far so good there. Can you close your eyes real tight for me? Can you squint? Okay. Okay, cool. Can you puff out your cheeks for me like this? Nice. Alright. Next thing we're gonna do, I'm gonna test your hearing. So basically, I'm gonna go in each of your ears and I'm gonna whisper something, and I want you to tell me what I whispered. Okay? Alright. You ready? Okay. Pineapple. Okay. Doctor. Okay. Cat. Okay. Pencil. Okay. Cicada. Okay, cool. Rhinoplasty. I'm just messing with you on that one. I'm also going to make some movements and sounds next to your head while your eyes are closed, and I want you to tell me which side it's coming from. Is that okay? Okay, cool. Ready? I'm gonna put both hands up so you can't tell. And you can close your eyes or not. I have both of them up. Okay, ready? Okay, good. Okay. Alright, that seems good. Next thing we will be on to is the mouth. Can you open and say ah for me? Where's my flashlight? Okay. Can you open and say ah? Keep going. Ah. Okay. Now can you say a few words for me? Just anything. Okay. I'm just listening for hoarseness in your voice and seeing if anything is off. I do want to look at your tongue again, just a little longer so I can get a better look. So can you say ah? Hold it. Hold it. Okay. I'll give you a break for a second. Can you lift your tongue up and touch the roof of your mouth? Okay. Can you move it side to side? Okay. Can you flatten it? Okay, cool. That looks all good. Now I want you to, I'm going to push your shoulders down, and I want you to push against me and trying to push them up as hard as you can, okay? Okay, ready? Alright, I'm gonna start pushing down. Push against them. Hard as you can. Okay, that's good. Now, I want you to do the same thing with your head, but I'm gonna push it one way. I want you to fight against it as hard as you can, okay? Alright, go. Okay, good. Now I'm gonna do the other side. And go. Nice, good job. That looks all good. Already checked your tongue. And then I'm gonna put my hands here and touch your cheeks real quick. And I want you to push your tongue like that into your cheek. And I'm gonna push down. Try to fight it. Okay. Okay. Alright. And I'm just gonna touch your face a little bit. Let me know if it feels like you can't feel any part of your face. Okay. I think those are all the tests I need to do today. I will speak with one of the doctors, and we're going to try to figure out what's causing that issue, okay? You did pretty good for most of the tests. The only issue you had, your peripheral vision is kind of tight. Does that make sense? So, I might have them do another eye exam on you, but other than that, everything looked good. Alright, well, if you have any issues, feel free to send us a message. I'm sure you have my chart. If you start feeling anything very serious, any pain, I want you to go to the ER, of course. So, do you have any questions for me? Okay, awesome. Well, I hope we can figure out what's going on and that we can get you feeling better. But you'll be hearing from me soon. Okay. I'll see you later.